Environmental Health Impact Assessment, MQB7034, Environmental Health. Part 7, Health Impact of Development. What are the health impact of development? When we discuss on the health impact on development, we need to look at two aspects: the beneficial effect of development and the adverse effect of development. We also need to look at the stages of development, that is, from the time the site is acquired and the preparation of the site, during the construction stage, what are the health impact during this phase, what are the health impact during the operation phase, and what are the health impact when the operation ceases or stops. An example that we can use is the development of sanitary landfill. It starts with the site acquisition of the land for the sanitary landfill, followed with the construction of the infrastructure for the landfill, for example, construction of roads and wastewater treatment and disposal plant. And then the main health impact of a sanitary landfill is during the operation phase. During this phase, we need to consider the various environmental issues. For example, potential contamination of the ground and surface water. All landfill will have a lifespan depending on the size and amount of waste stream. After the landfill ceases its operation, there needs to be rehabilitation of the area, and this is also something that we need to consider during as a health impact of development. Developmental projects often introduce environmental changes. Environmental contamination is one of the main factors that need to be considered. It can result in the contamination of air, water, soil, posing risk to public health. Air pollution, emission from construction, industrial activities, and vehicular traffic release pollutants like particulate matters, PM2.5 and PM10, nitrous oxide, and sulfur dioxide, increasing respiratory and cardiovascular risk. Water and soil pollution, water contamination, discharge of untreated industrial effluent and runoff from construction site can pollute water sources and causing waterborne illnesses like cholera, dysentery, hepatitis A, and chemical contamination, example, endocrine disruptors. Soil pollution, improper disposal of hazardous waste and disposition of heavy metals can degrade soil quality, impacting food safety and leading to long-term health effects such as cancer and neurological disorder. It can also contaminate the groundwater. Noise is another important consideration in the aspect of environmental noise. Noise causes hearing impairment, mental health and stress-related condition, sleep disturbances, and cardiovascular effects. For environmental noise, we are concerned more with the noise causing mental health issue, which is different from occupational noise exposure, where we are concerned with noise-induced hearing loss. The level of noise allowed differ based on different settings and time of the day. Example, in hospital, school, and residential zone, the level of noise allowed is lowered compared to commercial and industrial zones. The noise level for daytime and nighttime also differs. Access to safe drinking water is a fundamental for public health and a key determinant of community well-being. Development projects can significantly influence water quality and availability, positively or negatively impacting the health outcomes. In any development area, we need to identify the sources of water used by community, that is, tap water, spring, river, or well water. It's important for us to protect sources of water from contamination. Water can be contaminated due to surface or groundwater contamination. Development brings both positive and negative impact to job and income of the community. The positive impact includes improved access to employment, improved quality of life, and community development. Higher income enables better access to healthcare services, medicine and preventive care, reducing disease burden. Employment boosts self-esteem and social inclusion, positively impacting mental health. Job creation can stimulate local economies, funding public health initiatives and social services. There are also negative impact. Occupational hazard, income inequality, and loss of income for locals. Employment is in unsafe environment, example construction, mining, may increase the risk of injuries, respiratory illness issues, and long-term illnesses. Unequal distribution of job opportunities may widen health disparity, affecting marginalized groups. The local also have the risk of lost income due to other factors. In assessing health impact of development with relation to working condition, the focus is on working condition of the people directly or indirectly involved in the development. Although this may not be related to community, it is important to understand on the spillover effect of poor work condition on the community. They are both positive and negative impact. The positive impact include enhanced safety standards, job satisfaction, and skill development. Development policy that prioritize occupational health and safety reduces accident, injuries, and exposure to hazardous material. Supportive work environment with adequate breaks, economic setup, and access to healthcare services improve employee morale and mental health. Opportunities for training and skill building enhance workers' capabilities and long-term career prospect, positively impacting their mental and financial health. The negative impact includes exposure to hazard, psychosocial stress, and inadequate facilities. Workers in construction, mining, and industrial setting may face risk from chemical, dust, noise, and extreme weather conditions, leading to chronic illnesses or injuries. Long working hours, job insecurity, high workload can result in stress, anxiety, and depression. Lack of proper sanitation, rest areas, and access to clean drinking water can lead to communicable disease and lower overall well-being of the workers. Housing is a fundamental determinant of health. Development projects that improve housing conditions can significantly enhance public health outcomes. Safe, adequate, and affordable housing support physical, mental, and social well-being by providing a secure and healthy living environment. The positive impact of housing includes improved living standard, enhanced access to utilities, and social and psychological benefit. Secure housing fosters a sense of stability, reducing stress and promoting mental health. The negative impact includes displacement risk, overcrowding, and affordability for the locals. Developmental projects may force communities to relocate, leading to mental health issues such as anxiety and depression, and disrupting social networks. Poorly planned development can result in overcrowding, increasing the risk of communicable disease and strain to local infrastructure. New development may lead to increase on land and house pricing, leading to affordability issue for local residents. Overcrowding is a common issue arising from poor planned development projects, in particular in urban areas. It occurs with population density surpasses capacity of housing infrastructure and resources, leading to significant public health concern. Health impact of overcrowding include communicable diseases, mental health issue, poor sanitation and hygiene, solid waste, food additive, and injuries and accidents. Food affordability and availability is also important leading to nutritional deficiency. Developmental projects significantly impact the prevalence and management of non-communicable diseases such as cardiovascular disease, diabetes, cancer, and respiratory illnesses, air pollution, unhealthy lifestyle, stress and mental health, exposure to carcinogen. Industrial activity and increased vehicle traffic contribute to air pollution, exacerbating cardiovascular and respiratory conditions. Urbanization and sedentary lifestyle associated with development can increase obesity, hypertension, and diabetes rates. Stress and mental health. High-stress environment, including job insecurity, urban overcrowding, contribute to mental health disorder and cardiovascular risk. Poorly regulated industry and agricultural activities may expose communities to carcinogen substances, increasing cancer risk. Development projects can also significantly influence the spread of and control of communicable disease, particularly when they involve large-scale infrastructure and population migration. While development can improve healthcare access and sanitation, it may also create conditions that facilitates disease transmission if not managed properly. Health impact of communicable disease include increased transmission, destruction of ecosystem. Construction site workers, camp, and densely populated urban areas can become hotspots for communicable disease like dengue and malaria. There's also risk for respiratory disease like tuberculosis due to inadequate sanitation, crowded living conditions. Development project in forest area and rural area may disrupt ecosystem, increasing human exposure to vector-borne and zoonotic diseases like leptospirosis and lymphatic filariasis. The risk of increase in sexually transmitted disease is another important consideration during the developmental period. Other conditions that needs to be considered include drug and alcohol issues. The changes in the population dynamics from the developmental project during the construction and operation phase can lead to social issues in the community. It's important for us to consider how changes will affect social cohesion in the community. And finally, development will lead to increase in traffic in the area. It's important for us to consider how traffic is managed during the construction and operation phase so that it does not lead to increased risk for the local residents. The most important is the healthcare system. We must evaluate whether the developmental project will lead to strain of the healthcare services in the area. The consideration should include the construction and operation phase of the developmental project, whether there is increased need for healthcare and how are we going to cater for the increased needs of healthcare.